Hello. Is anyone on the call? Hello.
Hello.
Hi, how are you?
Good, thanks.
Thank you for joining.
No worries, no worries. Let me turn on mine too.
Thank you. I feel like I need to back this up a little bit, but
Yeah, I was trying to figure it also out.
the best that we can do.
I'll do. I'll do.
Is this actually a person?
So we've got one more other person in the room with us.
I mean, I don't know. Was that you who typed hi?
Sorry?
Was that you who typed hi?
No. So that's the other person that's with us. Yes, sisters, hi. Welcome. Okay. Well, we'll just wait for more people to join, so I'll turn off my camera for the time being.
Me too. Hello, welcome.
waxba codka ma soo baxaya waay headphones maad haysataa dee waxaanan raba inaan dhegeysto cod ma soo baxaya and I don't know what's going on.
Hello? I think you probably can't hear anything because the session hasn't started yet.
Hi, everyone. Thanks so much for joining. I think we'll wait for maybe another 5 minutes because we're waiting on our other speaker. Could you just let me know if everyone can hear me clearly? Hi, everyone. Sorry about the delay. It seems that one of our other panelists has been unable to join it. I'm not quite sure where she is, but we'll just give it another minute or two and then I'll just start anyways. Thanks so much for your patience. Okay, so hi everyone, we're going to start. It seems that one of our panelists, Samira, was unable to join us today, unfortunately. So we'll just go ahead with Kadra.
Hey, salam alaikum.
Here. Hi, assalamu alaikum. How are you?
I'm good, thank you. How are you? Can you see me?
Good, yes, we can.
Excellent. Hiya. Sorry about that. I just thought there was a bit of a confusion with the times.
Oh, no worries. I was just announced that you weren't going to make it, but now you're here, so great.
Excellent.
So yeah, thank you all so much for joining us on our panel discussion today, and we're going to talk about how you can land a job in healthcare. So just a brief rundown, I'm going to very quickly introduce the network, then we're going to have the discussion with the panelists, we'll have a quick Q&A session, and then finally close with some feedback surveys. So just some housekeeping points. Please keep your microphones on mute when you're not talking for good sound quality. And then if you have any questions, just type them in the Q&A box. So yeah, just a quick background on Anaga. So I'm Kule, I'm the founder of the network. I'm an international trade and development professional. I'm from I'm a Kenyan Somali, but currently based in Geneva, Switzerland. I work for an agency called the ITC. It's a joint agency of the United Nations and the World Trade Organization. And I work with SMEs to help them scale and grow their business, specifically with women entrepreneurs. Before joining the ITC, I was with the WTO. And then prior to that, I actually made a career switch. I was in finance, so come from an investment banking and Islamic finance background. So the network launched in January. We had a really, really great event in collaboration with the LSE Somali Society. And then we had planned one for March, but obviously our good friend Corona had other plans. So now we're here with a virtual event, so I'm really, really excited. So quick story time about sort of why the network and why I decided to launch it. So I've really founded it so that it could be a resource for Somali students and recent graduates. And we hope to really support Somali youth in their career journeys. And I think it was something that I really wanted to launch following my career journey. So like I said, I made a career change, and it really wouldn't have been possible without the support of a phenomenal Somali woman. She works for the Office of the President, and she really took me under her wing as a mentor and supported my journey here in Geneva. Without her, I definitely would not have been able to have landed the role that I had with the WTO, and even the team that I'm on right now. I was able to connect with them following a meeting that I attended with her. So I really wanted to help other students kind of have a similar experience to the one that I had, so they can get ahead in their careers. So a few main things that I'm really trying to achieve with this network. So first and foremost, to create a space where career advice and guidance is tailored to the Somali experience. So I went to university in the UK, and I found that while yes, there are great careers resources, I don't think it's specific to the experience of Somalis, right? So yes, they can give you tips and tricks on your CVs and your cover letters, but there's a lot of unspoken rules and kind of games that you need to play when you're trying to get ahead in your career. Number two was social capital. Ultimately, in today's very global world, your network is your net worth, and you're really not going to get anywhere, at least like get an interview without your CV at least being pushed through by someone that you know. And lastly, it was really for representation purposes. I think definitely in the field that I'm working in, international trade, I'm the only Somali here in Geneva who works in trade, which is like really crazy to me because we're so entrepreneurial by nature. And I think before meeting Marianne, because she was probably the closest person to trade, but she works in trade from a government perspective, I never ever would have considered it. So imagine like if you wanted to be an astronaut as a Somali, but subconsciously you've never seen sort of a Black Muslim Somali person in that role, like you would never even think that that was something that was available to you. So I really want this platform to be a space where I kind of collect all of these great professionals and make them available to you so that you can reach out to them by email and build your relationships and speak with them. So I'm going to tie things up here. I'd really like to hear what you guys would be interested in kind of getting from this network. So please feel free to reach out to us. You can find us on Instagram, on LinkedIn. Our website is currently under construction, but yeah, I'm always available on the email that's listed there. So don't feel shy to give me a shout. So without further ado, on to today's event. So we are, as you know, living in very unprecedented times. I know everyone definitely thought, I mean, I had big plans for 2020, like all the travels I was gonna do and all the big slayage that was gonna happen, but 2020 had its own plans from the Australia fires, COVID, Corona, like it really will not give us a break. But as hard as things are, I think there are some areas where the sun is still shining, in the sense that there are still some areas where there are a lot of vacancies, and healthcare is one of those industries. So that's a positive for the now, but I think even beyond COVID-19, healthcare research indicates that employment in the healthcare sector is expected to grow around 14% in the next 10 years. So this is due to our growing populations, more people who will be older, and then also just chronic diseases as a result of sort of the very sedentary lifestyles that we live and lifestyles where we eat lots of processed foods. But as students, now that you've heard that, or young professionals, you're probably wondering, what are the areas of work that are expected to have the best outlook? What are the occupations? What do they pay? How do I get in there? So our discussion today hopes to shed light on some of these areas. So without further ado, I'm going to allow our speakers to introduce themselves. So Samira, please go ahead.
Hi, assalamu alaikum to all of you. Thank you so much, Kule, for inviting me on this amazing workshop. It's quite a great idea to be able to capitalize on the time we have to be able to still work towards our goals and dreams. My name is Samira Hassan. I'm also known as Dr. Samira, and I am a GP based in Leicester. Yeah, I don't know what else to say about myself.
And Kadra?
Yes, assalamu alaikum everyone, and once again Kule and the Anaga network, thank you for organizing this and bringing us all together and giving us the platform to share our wealth of knowledge in our respective fields with our prospect colleagues, quote unquote. So as Kule said, my name is Kadra. I am a psychological well-being practitioner or psychological therapist I'm currently based in Geneva with Kule, but I have done my training and worked within the NHS and was training in London and lived in London. So I'm originally from the UK. I'm now working with UNHCR, which is the United Nations High Commissioner for Refugees here in Geneva as a psychological therapist. And I'm working predominantly with our staff, so thinking about staff well-being, thinking about staff health, and trying to promote that and thinking about some of the impact. You will hear a lot about well-being, and staff well-being is kind of something that's growing. It's a field that is growing. It's a lot bigger in the private sector than it is in public sectors at the moment, but it is definitely something that is up on the rise, and there's kind of a lot of opportunities in that. So I will talk to you a little bit more about it in detail later.
Okay, great. So thank you both for your really, really great introductions. So we'll get into the discussion now. Samira, again, we'll start with you. What made you decide to embark on a career in healthcare?
So that question actually almost conjures up an essay in my mind, because my route into medicine was a very convoluted one. But I will just summarize by saying that I've always known from a very young age that I've always wanted to work in healthcare. That was always a certain thing. Because of my love for biology, human anatomy, and fascination with that, but also because of the fact that it marries up to my two ideals, which is the ability to help the most vulnerable of people, as well as being able to make a comfortable living out of, which was essentially the summary of it when I was younger. But of course, as time went on, I moved from the Middle East to the UK. There's been a lot of things on the journey that's really made me wobble on my firm ambition to become a medical doctor. So I had to do a lot of soul searching and do tons of work experience still within the healthcare field before I finally realized, yes, that medicine was for me all along. And that cemented it, which is why when I went for medical school applications, which took me 3 goes, by the way, I managed to get in eventually, but didn't give up.
Okay, great. And may I just confirm so you're a GP practitioner, and I don't know much about healthcare, but is there sort of like a specialism that you have? Apologies if I sound really
okay. It's different in different countries, and obviously GP means something different in different health settings. In the UK, that is a specialist in family medicine. In the US, it's called a family medical physician. They don't call it GPs, so it's the equivalent thing. And that is something that you specialize in after completing medical school, doing 2 years of foundation training. And then when you're choosing the specialty program that you wish to embark on, general practice is one of them. So it is considered a specialty in its own right. And it is a specialty in which you place health in the context of the patient's social system, family, psychological well-being, which is why it suits me, I think, very much so, because it's a very holistic view of addressing health needs and health concerns. And also the fact that you deal with families from birth all the way to old age. So it's a great specialty.
Okay, great. And Kadra, I think it was really, really cool meeting you in Geneva and then learning that you're a therapist, because we know all about mental health and how sort of what a taboo it is in our community. So how did you get sort of into the industry, and then why did you end up staying?
Okay, so I had a very kind of simple and clear sense of what I wanted to do quite early on. As a child, as a young adult, I was very curious, some would call me nosy, about human experiences, particularly interested in developmental. So thinking about how we navigate the world, how do we develop from children? And that kind of led me to studying psychology at A-level and then studying it at university. And it really cemented my curiosity, but also my interest in the field. I will go into detail about it. The route to becoming a psychological therapist in the UK is not easy generally for everyone, but it's also a little bit more difficult from anyone from an ethnic background, in particular Somalis, because there aren't that many Somalis in the field. But also I was quite aware of the psychological difficulties and the issue of mental health within our community. So I was kind of always aware of those issues. So Psychiatry was my other option, but I'm not the best medic. So paired up with my curiosity about the human mind as well as psychology, I think the two kind of married well to let me down this profession. And what has kept me, I mean, there's days where I've wanted to quit. There's days where I've thought, what am I doing? Why am I doing this? But I think just generally seeing the impact that you make, and sometimes you do see the direct consequences of the work that you're doing, and being able to connect with people. And a lot of what we do is education. So we do what's called psychoeducation, which is teaching people about themselves. And to be able to do that and be in a teaching kind of role really helps me in staying in the role and reaping the benefits as a therapist.
Okay, great. So then moving on, I know, even though I mean, my career hasn't been too long so far, maybe 3-4 years of experience. But I think definitely if I could go back in time, there's things that I maybe would have done differently. So Samira, what advice would you have sort of for others who may want to set off in the same direction as you?
I think the most difficult thing with that most people perceive to be in medicine is the ability to get into medical school. I think in our community especially, I've come across tons of people who have shown not only an interest, but a desire and a passion to pursue a career in medicine. And that's almost always the case in people who want to pursue medicine. It's more than just a career for them. It's a different lifestyle. It's almost like a purpose and a calling, is how many of them view it, which is why it is always a very difficult roller coaster, particularly an emotional roller coaster during application to medical school for many of us, because it is a difficult time filled with uncertainty. And for most of people who want to get into medical school, it's almost medicine or nothing. And I know I certainly was one of those during that process. So the advice I would give to people going through or starting at the beginning of this journey, and there are many of them who contact me on a daily basis, is to know clearly what your goals are and understand that, and find out if medicine is truly the career for you. Because oftentimes people have a very rosy viewed lens in which they're viewing this career, and it does have its own set of challenges. It may not suit everybody, no matter what your GCSE or A levels or academic achievements are. It may not suit everybody, and it's certainly not the profession to get into if it's big bucks you're after. But it's something that you really need to research for yourself, which is why I will often and always advise people to do tons of work experience as much as they can, if not in hospitals, but at least in a care setting, because oftentimes you will come across people who have medical needs, particularly in care settings, social needs, and this is often what medics address as well. So doing tons of work experience is already a prerequisite for medical school applications anyway, but it's certainly very important for people who want to embark on this very long, arduous journey to be able to find out for themselves if it's truly the course for them. Because I did have colleagues in medical school who had dropped out either partway through medical school or at the end of medical school, or even at the end of foundation training, simply because they realized medicine wasn't for them. And a lot of them tend to be people who are pushed into medicine by their parents, by their society, by their peers, because they had the grades for it. And oftentimes that is what is expected of you, especially if you're from a BAME background. So do your work experience, be really clear about what is going to be expected of you as a doctor. But then saying that, understand that if the passion is there, the challenges won't matter too much. It won't bother you as much when you get to them, and you will be able to overcome them, as countless others like myself have been able to do. And just to remind people, and remind some people who were like my 16-year-old self, that medicine doesn't have to consume your life. It's not the fact that you're signing your life away to a lifelong career that's taken over your life, which used to be the case back in the day when junior doctors used to work 100-hour weeks. Luckily in the UK, we have a massive emphasis on work-life balance, and the European Working Time Directive has brought a massive change in that. I know we're about to untangle ourselves from the rest of Europe, but that has been something that's been ingrained in the society of medical culture here in the UK because of the European Working Time Directive, which I'm very grateful for, because that is actually what changed my mind. As much as I loved medicine, I really was worried that it would almost consume my ability to be able to expand or explore any other aspects of who I am as a person. So making sure that you understand that it is full of challenges, but if the passion and purpose is truly there, the challenges and the hard work will not matter. Nothing worth having in life is easy. I would definitely say put your head down, do the research, and give it your all, and maybe give it a good few goes, because only you know when you decide that enough is enough, or you may be even successful to be able to get it. So understanding that it does have its challenges, making sure you are aware of what these challenges may be, and also knowing that no two doctors are the same. Somebody's challenges may not be your own, even if you follow the same path, and that things can be tailored to you, your lifestyle, your circumstances, and that all these difficulties always do have an answer. So I would always say, go for it, because unless you do, you will always live with regret.
I think that was really well summarized. Lots of good tips. So I hope everyone took some good notes. And then sort of, Kadra, I guess on that point, what helped you get to where you are today? Because I can imagine, you know, I don't know if there was a Somali therapist who you kind of modeled things on, and I guess no. So yeah, sort of how did you get to where you are today?
So I've been working in the NHS coming up to 6 years, and in that 6 years of working there, I've not come across a single Somali mental health profession. So whether that is a Somali mental health doctor, so psychiatrist, mental health nurses, or even anyone that is in the kind of vicinity, and that's due to many different reasons. And I think because mental health and the mental health profession and the various different roles that embody it is not clear. It's not clear for BME communities, but it's just generally is a more difficult web to untangle. And Samira can echo this. When you hear the term medicine, it's not one route, it's not a single kind of goal that everyone reaches. And when you're embarking a career in mental health, is very much similar. And you have to do your own research and find out what is it that you're looking for, what is it that you're looking to kind of gain out of it. The thing that helped me was sheer determination and research. I navigated this field quite blindly on my own. Many professors and professions have told us clinical psychology, becoming a psychological therapist, rule that out. It's not going to happen for you. It's oversubscribed. Unless you're blonde and white and your dad or mum knows someone, the likelihood of you getting onto that is very minimum. But Somali and hey, we're Somalis, when you say no, that kind of gets you to straighten up your back and gives you that extra push and determination that you need. So what I did quite early on in my undergrad study was have a clear sense of where I wanted to go and get a clear sense of the different professions within psychology. So when you study psychology undergrad, it's a very broad subject. You don't leave with any kind of vocational skills or any clear sense of any of the professions that you could potentially kind of go into, the different routes. So what I did in my first year was clearly kind of outline the roles that I could embark in, and then summarize, pick my top 3, and then think, okay, what is my career goal? How do I get to each one of these, and what do I need? What skills do I need to get there? And this is something that I, had stumbled upon. Had I not been told that this is not something I could do, I probably wouldn't have. I would have been quite relaxed and enjoyed my undergrad studies, as opposed to feeling like I needed to be on a chase. But it helped me, and it gave me a sense of what is out there. And through that, I'd kind of planned out a career plan for myself quite early on, and kind of had a step plan. So starting from the bottom and working my way up, very much like what Samira said, healthcare jobs, care roles will give you a sense of what is out there. It will give you a sense of the kind of person you are as an individual, and it will really teach you a lot about your work ethics, but also where your own desires and your own fulfillments lay in. Each one of us will be fulfilled in a different way, depending on the roles that we're doing. And I think what was really helpful for me to know and get a sense of is that when you're embarking on a career, it's not about the bucks. It's not about how much are you going to make. It's not about whether you've got the academic skills or the personal skills to do your job, but also what does this actually do for you? How does this impact your life, and how does this make you feel as an individual? We talk a lot about something called self-actualization, which is working up to your ideal self and meeting kind of all your own personal needs. So it's really important that you know what is it about the particular roles and the particular careers that you're pursuing that is going to help you feel fulfilled as a human. And for me, definitely being in a caregiving role was that. So I kind of, the different roles that I navigated put me at the center of being the main caregiver. And then that's kind of what kept me going. So I definitely, within the field, had definitely taken many detours and gone down one path and decided, nope, this is not for me, and come back the other. And the reason why I was able to do that is because I had a clear sense of what I'm looking for in the job.
Can I just add that, Kule? I just listening to you speak, well, it's just made me think about my own journey, and I just thought it might be useful to share a little bit of it. I've talked about this several times before on different platforms, but people often think that if you are a well-established medic, that this is something that you were born thinking that you were going to do, you've worked your whole life towards it, that you've had the head start because you knew you want to do medicine, and therefore you were able to focus on your GCSEs and A-levels, so on and so forth. That is not the case. I know as a child, many times my parents or extended family would often call me Dr. Samira, and I don't know why that was the case. I don't remember ever saying I wanted to be a medic, but it's almost, I feel like a psychological indoctrination that was going on, which actually, but that's, but coming to the UK, I managed to do my GCSEs really well in the Middle East, and then I came and I did my A-levels, and I've always aimed to get the best. I've always been that kind of competitive spirit. But there was a time after that period, because I couldn't apply to university straight away, I had a year or two actually where I really had to try and figure out what else I needed to do. And in that time, my passion or ambition or desire to do medicine was really, really brought to question. And I actually had to go through a whole period of soul searching, because my entire life I felt like I was working towards medicine because that was what was expected of me. But there came a point where I had to really think for myself, is this what I truly wanted to do? Because I was now starting to understand that it involved lifelong learning, lifelong studies, that it involved constant exams, that it involved nights and weekends and missing out on social events such as weddings and family celebrations and possibly Eid and so on and so forth. So now that I was starting to see the cons and the negatives stack up, I needed to sit down with myself and evaluate whether this was truly what I wanted to do and not just something that I wanted to appease my parents for, which I think all of us want to do, because we do want to make their hard work and sacrifice worth it. And the more I dug into it, because again, as you would probably reiterate, that if you do look at something through a negative lens, you will only see negative. So at this point, I was actually looking for faults in medicine, and I found tons. I found the fact that it would mean that I would literally resign to a life of studies and work and audits and research and everything. My whole living, breathing space was to be about medicine and developing in that career. And I know many colleagues of mine who to this very day actually attach their entire sense of value to their title and to the fact that they're researchers or they're doctors, which is fair enough if that's where you want to find your value and validation from. But that's never been something I've always been easy with. And seeing that, I started to wonder if medicine was for me. And in that time, I didn't speak to anybody. I just did a ton of research. I think I spoke to a few people who were starting to tell me that actually it's no point. And you know, the Somali community, you're going to hear tons of people who say, "Gabar batahai," you know, you're going to end up getting married and having kids, and what's the point? All of these eventually, even though I've always been a stubborn and very tough-minded and very focused child, at some point it starts to wear down your defenses. And at 16, 17 years old of age, it was very difficult for me to envision that the best part of my years is going to be taken away by this particular career. So when I did finally apply to medicine and I did get the offer, I declined it. I said, thanks, but no thanks. And then I spent the following year doing tons of different work experiences. I worked in occupational therapy, audiology, physiotherapy, biomedical science. I literally arranged shadowing experiences left, right, and center. At this point, I think it was all a frenzy. It was a sense of desperation that was going on because I knew I let go of medicine. And in my mind, it was for good reason. It's obviously been after a year of soul searching. So I needed to replace that with something, because I've always come to the UK knowing that I needed to live up to my parents' expectations, go to university and build a career. What this was, I had no idea at this point. So the pressure and you know, the time constraint was actually piling on. And at that time, it's difficult to make any meaningful decisions. So I would go rolling from one work experience to another while I was doing evening classes in college to keep up with extra A-levels, just to make sure that people didn't say that you were out of education for a while. The whole thing was a mess. In the end of that year, I realized that medicine was for me after all. And it's probably a process I needed to have done before, but because I was sat in the comfort of knowing, oh, I'm going to do medicine, I'm working towards that, I didn't really explore it for myself. So that year really shook me up and made me peel back the layers and reevaluate who I was as a person, what I valued in life, what I enjoyed, what my personality actually was, before I could decide which career fits that.
Yeah.
And that year, honestly, was the most valuable, the most stressful. I still got the gray hairs to prove it. The most stressful year of my life, but actually the most valuable, because it now made me realize that medicine was not only for me, it definitely was the only thing I saw myself doing. And at the time, it was pediatrics. So then when I started applying to medicine, this is the second application. When I did apply the second time, I got all 4 rejections, which for any person who's trying to get into medicine is like almost like a death sentence career-wise, because you're not even getting into medicine. You don't even get to the interviews. But then I knew it was medicine or nothing. And I think at that point, I probably needed some therapy anyway, because I had a lot going on. I reapplied, and this time again, I had all 4 rejections. And then I was thinking to myself, am I ready to give myself up for a 4th year of application to hear the same no's again? Because I needed to produce something where I could say to my parents, this is going to be my career, and something that I was comfortable with. So honestly, in my mind, I was thinking, I don't know what I'm going to do, but I don't really see myself putting myself through that emotional roller coaster, which I did require therapy for at the end of it, for the 4th time. But what I did is I sent an email to every one of the 4 universities that rejected me for the 2nd time to say, thank you so much for reviewing my application. I'm really grateful that you've given the opportunity to have a look at my application, but I would be grateful for some feedback and advice to improve on my application the following year. Knowing full well in my heart of hearts that I probably wasn't going to apply, because I don't think I had the emotional strength to go through it for the 4th time. And luckily, subhanAllah, Allah works in mysterious ways. 2 of them replied back saying that we actually wanted to interview you, but we couldn't find you. Back then, it was all paper applications, and something about the length of Somali names. They confused Samira Hassan with Samira Yusuf. Anyway, they thought we were 2 separate people. They were actually looking for me, but it got waylaid somewhere. And it was those emails that generated that response back, where University of Leicester and St. George's in London both said that we actually wanted to interview you, but we're looking for you. Bear in mind, at this point, interview season is over. Offers have already been given out. Students are looking for student loans and doing housing applications for student flats and so on and so forth. But they called me in for an interview, all the same. And I managed to get 2 unconditional offers, alhamdulillah. And I went for the one in St. George's in the end for my 1st year of medical school. So alhamdulillah, it's just weird the way things work, but I almost never got into medical school. But the important thing I wanted people to take away from that story is there will be a time you will feel like you're going to wobble. There will be a time where you're worried that what you're doing may not actually live up to who you see yourself as a person, because as you grow up, you start to realize what you truly value in life and what you're looking for in life. And therefore, oftentimes your job has to align with that. Otherwise, we get very low job satisfaction out of it. And it's very difficult to expect a 16, 15-year-old to know that. It's almost impossible. It's the way society is set up is you're supposed to know what you want to do for the rest of your life and be passionate about it all the time. But that's not realistic. But do take the time out. 1 or 2 years in the grand scheme of things is nothing. Do take the time out to figure out whether it truly is for you. Speak to experts in the field. Speak to people who are actually working in the field. What made a difference for me was the fact that I looked for Muslim female men. Again, it was about making sure that I was able to perform my duties as a Muslim woman, as well as being able to carry out medicine to the best of my ability and be the best at what I do. So I looked for people who I could see myself in, ask them about how it affected their work-life balance, family in the future, so on and so forth. And it was those answers that eventually helped me to realize that medicine was for me after all. It wasn't against my values or my core beliefs. So alhamdulillah, that helped me get back into it. So definitely take the time. The rush to go into university after A-levels is honestly not the best thing for a lot of people. Unless you're really clear and have done that research during your A-levels GCSEs, fine. But if you haven't, there's no time like investing in figuring out what you want to do, because a year or 2 spent trying to figure out what you want to do will save you 10 years in the future. So I would always advise people to really take the time out to speak to people in the field. Don't listen to the naysayers, and actually do the work experience and go out of your way to see how you fit into that career world.
I think, no, those were definitely really great points, and I definitely resonated with those myself. As someone who spent 4 years studying like finance and accounting, I really didn't want to do it, but my parents kind of forced me, as they know, don't really have much choice. Worked in banking and I remember my master's like the whole time applying for grad schemes, because that's kind of what they pump at you. Like if you don't in finance end up on a grad scheme in London, like you're basically going to be a failure. And I was an international student at the time, so my visa was riding on that too, and applied and finally landed one at like the end of May, and it was exam season. So I remember I'd come home like 2 a.m. super late after I'd been studying all day, And still, like, I was like, even if I send one application out, like, I have to do this. Got onto the grad scheme. It was amazing. And then I absolutely hated it when I started. I was like, no, I can't do this. And then left. And when I told my parents, like, yeah, I'm moving to Geneva. And I actually moved here initially, like, on an internship. And then they were like, what, you're going to go from, like, having already did internships, like, years ago. And then you've had, like, you know, you've then become a proper professional, like, staff. And then you want to go back to an internship. And then in a field that you didn't study in, like, that doesn't make any sense. But yeah, definitely resonate with both of you guys. And then two follow-up questions, because you both mentioned, you know, taking up carer jobs or finding work experience. So sort of what resources, I mean, I know LinkedIn is one, and if you just Google online, but I'm sure there are, I don't know, blogs that could probably give like a bit more guidance. So what tools and resources would you guys suggest that people could use?
So for a career in psychology or to become a therapist, I think in order for you to identify kind of work experience, I think what you first need to identify and understand is the profession. I think a lot of people don't have a clear sense of how to become a therapist or how to become a psychologist. And once you've done that research, it will kind of land itself into kind of various different ways. The way I initially did it was I kind of got a sense of what the main umbrellas are in terms of career in psychology. So one of them is to become a clinical psychologist, which is where you deliver psychological therapies and you are a therapist, but you also do a lot of research, service development, and it's kind of the nook and the crook of the profession, because you get to do everything. And then there's occupational therapists and occupational psychologists, but then there's also educational psychologists, forensic psychologists, which works in forensic settings, so with prisons, people that have committed kind of crimes. And once you've kind of identified those the main sectors, you then do kind of a top-down approach and kind of figure out what are the different steps in that, and then each one of those will kind of open it itself up. So what I did was I knew I wanted to be a clinical psychologist, so I had done that, and then in each of those I'd identify how I can go up there. So my first step was to volunteer to work with children with autism. So what I've done is just reached out to the community and said, does anybody know anyone that has an autistic child, children with autism that I can work with, that I can babysit? I've got kind of the basic knowledge, and luckily for me, there was kind of a close relative and family member who did have a child with autism, so I was working kind of babysitting him. So when it came to my CV, outside of graduating from a university, I already had some experience. It wasn't formal experience, but it was some experience in working with children with autism, which allowed me to then apply for a job working as a teaching assistant in school for children with learning disabilities. So what I would say is identify where your pockets are. So research your local GP. What facilities do they have? Research your local schools. What education programs do they have? Don't go for the big goal, so don't go for the end goal. Look at a kind of more achievable step, and think about reaching out and just volunteering, spending an hour or two a week working as a receptionist at your local GP, because you don't understand how valuable of an experience that is, to give you the outside view into the profession, and to give you a sense of what a day in the life of a GP would look like, a day in the life of a healthcare assistant is like, a day in the life of a psychologist. And then what that will do is it will open up that little bit of experience, will then land you and lead you to kind of gain more experience within that environment. While I was working as a teaching assistant, I also worked in a psychiatric hospital in Woking, Surrey. So I would do Monday to Friday, 9 to 5, working with children with autism. And when I say working with children with autism, I was working with children with severe and complex autism. So a lot of them were non-verbal children who weren't able to tend to their own basic needs. So I was doing a lot of physical manual job, as well as trying to educate these children. So a lot of the time I would come home battered and bruised, covered in all sorts of body fluids that you do not want to be covered in. And then on my weekends, I would do 12-hour shifts at a psychiatric ward, which I would say was 10 times harder than working Monday to Friday with children with autism, who will bite you, who will punch you, who, you know, felt like I was in an abusive relationship with, but loved, because you kind of you knew you were doing something for the greater good, and you knew that it wasn't from a malicious and intended kind of point. So I was doing the two at the same time, because I knew that in order for me to get onto my training, I need to have the understanding of the mental health settings, as well as understand kind of the another form of kind of psychological effect. So autism is considered as a neurodevelopmental disorder. So having that, and that falls in within the spectrum of psychology. So having that, those two gave me the sense of, you know, what my role would kind of embody. And a lot of the children are diagnosed by a psychologist. So for me, I had that sense of what the assessment process was. I knew kind of the level of support they needed. I had good sense of their care plan, and also a sense of what their future would look like and how they would develop. And then being in the kind of education setting, it opened up for me ways that I can think about improving my own knowledge and seeing kind of the role of the clinical psychologist in that. It also allowed me to have a critical point of view, and I think that's something that is going to be really important for any professions that you guys choose to embark on, is to have that critical view, to look at things from the rosy lens, but also from the lens of how can we improve, what can I do, where do I fit into this to better this profession, where's my contribution. So for me, working in that setting gave me that sense, and working in the mental health setting gave me the sense of the therapeutic intervention, but also giving me a broader knowledge of the various mental health difficulties that are affecting people, how they're diagnosed, their presentation, the medical kind of care plan. So in summary, what I would say is, when you get that clear career trajectory lined up for yourself, start from the bottom and reach out to your local resources. You'll find a lot in there. And I think within the Somali community, we have so much of untapped wealth in terms of volunteering opportunities, in terms of ways that you can give back, that will then land itself onto bettering your CV and making you stand out from the rest of your kind of peer students.
So I think with regards to how to build your CV for a medical career, a lot of it I resonate with what Khadra was saying, because it's absolutely true. I think with any science or care setting, but in particular with medicine, I think a lot has changed since my application, because you have to remember I applied to medical school over a decade ago now. But I know currently in some medical schools, if not all of them, stipulate a certain number of hours working in either a hospital or clinical setting, either GP or hospital. And part of that 70 hours has to be in a care setting of some sort. So I know there's been more structured and focused requirements when it comes to entry requirements. But in general, the best way to go about things is to understand that you don't just have to have hospital work experience to be able to apply into medical school. I think they're very well aware that not a lot of places would allow 16, 17, 18-year-olds into a clinical setting where there's a lot of issues with patient privacy, confidentiality, and some sensitive topics because of their age limit. But nevertheless, I would still urge and advise anybody who wants to go into medical school to think about this as early as you can, and apply. So when I was in sixth form in Cardiff, of course, most schools have a work experience scheme where they expect you to go off somewhere and do some sort of work experience for 2 weeks as part of the curriculum. But a lot of it was geared towards working in shops and retail stores and things like that, which wasn't something I was keen on doing anyway. So I didn't see the point of wasting my time in that. So I arranged for my own work experience. The way I did that is I reached out to the local hospital and I emailed the local deanery. In other words, you can also email the local undergraduate center, because every hospital will have an undergraduate center for obviously the medics and the nurses and the healthcare students, because a lot of them will be based there. Email them directly and ask about their formal hospital work experience or shadowing program, because almost every hospital in the country does have that now due to the sheer demand. But bear in mind that a lot of the time, especially in this day and age, and the requirement for this work experience, the waiting list for that would be really long. So if you know that you want to apply to medicine or want to have any chance of applying to medicine, think about this early on, even before starting A-levels or even at the beginning of doing your AS. apply to one of these work shadowing schemes, because it may well be that you may not be able to do it that summer, but you'll be able to do it the summer after. Either way, you know you have to have it done before you submit your application, because you want to talk about it and you want to verify the number of hours that's required. And they often require you to produce letters of reference to say that you've completed these hours. So starting early is key. So hospital work experiences schemes are obviously an available resource, but they're often oversubscribed and have long waiting lists, but I would apply nevertheless. Another thing you can do is directly email consultants yourself. So oftentimes you can find some names of some consultants through either the hospital directly by looking through your local NHS trusts or hospital trusts or district general hospitals or foundation trusts, any hospital near you basically. The smaller the hospital, the more likely it is that you may be able to get a really friendly consultant who may have the extra time to be able to take you under their wing and shadow you, because you have to bear in mind they're not being paid for this. And doctors tend to be overworked. So the big tertiary settings oftentimes may not have the time, but I would apply regardless. Cast out your fishing net as wide as possible and directly email these consultants. Phone up the hospital if you have to. Look at their website online, find out some names of consultants and ask for their NHS emails. And then you could directly email them. If you know them personally, of course, ask for their emails. And a lot of them would be sympathetic to your need to be able to have work experience shadowing and may take you under their wing if you show keenness and decisiveness that you really want to pursue medicine. So for example, those of you who are taking Hoyo, Ayeyo, Abo, or your uncles or your aunties to a hospital appointment and wanting to interpret or translate for them, just happen to slip in there that you actually want to pursue medicine and ask for their advice and ask them how they would suggest you go about looking for a work experience program, and if they wouldn't mind allowing you to shadow them for 1 week. Oftentimes, the only thing that is required is for you to sign a disclaimer form to say that you are willing to keep this confidential, patient data and patient privacy confidential, and that is practically it. A few housekeeping rules, and that's it. Some places will require you to have a, what's it called now? Is it called DBS? I keep losing the word. Just to make sure that you don't have a criminal record. I think it's called the DBS. Because this document sometimes takes weeks and weeks and months to actually produce. I remember I had to apply for a DBS, even though it was 2 weeks worth of shadowing program. I had to apply for that DBS and it took a month to come through. So that's why it's important to start early on, because some places will require you not to have a criminal record to even set foot into their wards. So you can apply for that. And it's something that will carry on for you guys, particularly if you get into medical school. It's something that will update itself regularly anyway. I've had mine over nearly 15 years now. So things to think about and important to consider when you're applying, and therefore it's important to apply early. So we talked about hospital work experience schemes. We talked about directly emailing consultants. The other thing I would suggest is using your contacts in either your community or your friend circles. We know a lot of our Asian, Indian, Pakistani friends have family members left, right, and center in medicine. And oftentimes it gives them a foot in the door where they're able to just shadow their uncle or shadow their dad or shadow their mum. And of course, that is an unfair advantage that many of our Somali kids don't have. So oftentimes I have tried recently to organize a work experience scheme for work with Somali kids that want to shadow me in my general practice. And I've managed to shadow 2 Somali kids so far, alhamdulillah, through agreement with my practice manager and setting up basic sets of rules. It's not that hard. But of course, not everybody can do that. And it's even more difficult to set that up individually in hospitals. But I would just ask you to use your contacts. So if you have a friend of a friend of a friend whose uncle or dad is in medicine, ask. You know, there's no harm in asking. Oftentimes people find it intimidating to directly approach a consultant, but they are the heads of the department. And if they say yes, everybody else will fall in line. And if you're able to show keenness to them through your email and tell them that you really want to do medicine and you want it for that 1 week, 2 weeks, whatever weeks it is, and be clear about your aims and your goals, oftentimes if they can accommodate you, they will. And if not, you've lost nothing. So email as many consultants as you can, use your contacts in the community, use your friendship circles, if they have any family members or friends who are in medicine, to contact them directly. And that's in hospital or in clinical settings. The other aspect of work experience for medicine is proving that you have the ability to work well in a caring, compassionate role, which doesn't always mean hospital or GP setting. And that could mean in care homes, it could be in play centers. So what I did, other than my 2 weeks shadowing experience I did in year 11 in cardiology, which I arranged for myself, the other work experience I had was working or volunteering as a teaching assistant with children with learning needs. So I sat in with a Somali child in the local primary school through a scheme called Pearl at the time. They gave us 2 days induction, and then I would work once a week with this child just to support his learning one-on-one within the classroom. That was done on a voluntary basis for a year. I've also worked in Bernardo's Children's Center, which is a charity, as a volunteer, just playing with the kids and you know, giving them that time and asking about them. Because I knew I not only wanted to do medicine, I was geared towards a role in pediatrics because that was my passion at that time. I went into medical school thinking I want to come out as a pediatrician, basically. So I did a lot of that. I've also worked in a local play center. It really helped to be Somali, to be honest with you. I used my Somaliness to the utmost because oftentimes people want to diversify their workforce. They want to diversify their staff to reflect the needs of their clients or their patients or people who come into their centers. And you have to see yourself as an asset because that's how they will see you. If you're able to market yourself as somebody who's, yes, caring, compassionate, and also doing this for a reason, but the fact that you speak Somali or you are Somali and better able to identify with the parents of these children or the patients who are Somali, it's always a plus. So use that as a selling point. I certainly used it not only in my work experience, but also in my personal statement, which I can talk about later. And also, you have that unique perspective as Somali young people that a lot of the time you have to interpret for your parents, for your uncles, for your aunties. You take them to the GPs, you take them to the hospital appointments. That is also part of, you know, delivering a care service in some ways. And even if it's not considered work experience, it's certainly something that you can talk about as something that broadened your horizons, improved your understanding of the importance of the cultural and language barriers in medicine and how that brings about health inequalities, you know, the importance of cultural health beliefs and how that has caused some mistrust with certain ethnic minority groups, particularly the Somalis, with the health trust, all of the things we're currently talking about in coronavirus and why coronavirus is disproportionately affecting BAME communities is exactly the kind of things that have been going on with the Somali community, like other ethnic minority groups for a long time. The fact that you really switched on to that and are able to talk about that is absolutely an asset because that's something I did. And many of us who tend to go back to Somalia, Somaliland, Djibouti, Kenya, or back home in general, use that time to actually look at what other healthcare settings look like. Because if you're able to compare and contrast and talk about how it made you, what you learned from these experiences in terms of the privileges that we have in the NHS, but also some of the flaws, some of the good points in the NHS, how that compares to healthcare settings back home, how that compares to how people access healthcare, how that compares to people's viewpoints on health beliefs, so on and so forth. You end up going into a much deeper and far more engaging and interesting discussion, which will certainly be picked upon during your interview process, and it will actually make you stand above the crowd. Because the fun fact for me is, which many people don't know, is I did not even have the basic entry requirements for medicine to get into medical school. And we almost all know that if you don't have the basic A's, okay, back then it was 2 A's and a B, and I had an A and 2 B's. Now it's all A stars. So I did not have the basic minimum entry requirements, but I still managed to get into medical school, of course, you know, by the grace of Allah. But I also believe that my Somaliness played a key role because most of my interview was about Somalia, to be honest with you, and my experience back home. I didn't have that typical interview where they quizzed me on my scientific knowledge on the latest, you know, scientific news and what's being published in, you know, journals and research and so on and so forth, which I would have miserably failed in because at that time I wasn't really clued onto it. So talk about what is uniquely you, not only in terms of your work experience, but the whole point of doing the work experience is also talk about in the personal statements and your interview, and try and pick up on points that make you stand out from the crowd. And using your Somaliness is a big, big, big weapon, if you ask me. And then finally, another possibility of work experience is just volunteering to work in your local hospice or local, you know, hospital wards, particularly the geriatric wards, the wards where a lot of the elderly patients are looked after. Just offer to do the tea rounds because there's always tea rounds going on, tea and biscuit rounds. Lots of young people come and volunteer, just sitting with the elderly people, giving them a cup of tea, having a chat with them, finding out about their life story. All of these things are valued because it is part of the holistic treatment and care that hospitals wish to provide, not just medical and clinical care. And the fact that you're offering the service for free, as long as they do the DBS checks and make sure that you don't have a background in criminality, they'd be more than happy for you to join in and stay on the wards, even if it's for an hour doing the tea rounds, speaking to these elderly people. And that shows care, compassion, dedication to the career, and the fact that you really want to go above and beyond just seeing the disease, but want to treat the person as a whole, which is always what medicine is about. It's the holistic viewpoint. All of these things would give you some ideas into the sort of experience and the hours you can get in the care setting. So understand it's not just clinical, it's difficult but not impossible to sort out, but also care settings such as local play centers, schools, care homes, doing tea rounds in the local hospice, doing fundraisers, so on and so forth. I hope that gives people some ideas on what to do.
I think those were really, really great answers from both of you guys. And just one final question before then I wrap up the conversation. I think you gave good advice about how to sort of get into the field generally, but now to kind of focus in a little more, because I know a lot of students will be graduating very soon. Graduation season is upon us. So how can young people looking to land a job in healthcare leverage the crisis to secure a role for them? I know it's quite open-ended one, but go for it.
If I just start, I think Samira's last point, I think is going to be the thing that you want to latch onto at this point. Think about what makes you unique, what makes you stand out from the crowd. If you think about the amount of students that are in your cohort and then times that by all the universities, there will be a large number of students applying to the same profession as you. So think about what makes you uniquely different. Your Somaliness is such a great asset. I also have used it as a weapon. I oftentimes turn up on my interviews and I tell them, so you have an untapped and unsupported community. I am here as a Somali practitioner who speaks the language, who's got the cultural awareness and the cultural knowledge, who can provide an asset to your service. And with that, what you do is you demonstrate the need of the community. You know, a lot of health jobs are not about the individual care, but it's about the community care, and it's about how can you increase the number of people accessing support and engaging with these services. So if you're able to identify how your Somaliness and your unique traits and abilities are going to increase that, definitely focus on that. And what I would really suggest is to don't rush into it. You know, you will have another 45 years to kind of work on your craft, to work on your career. So do take that time to sit with yourself and to really think about where you are at this point, what you have gone through. You know, you have gone from studying for the last 21 years, having your future planned out for you by various different institutions, to now having to make decisions. And oftentimes people think that the decisions that they make at 16 about their career, they need to stick with and see that to the end. But this is your opportunity to stop and to reflect and to really think about yourself in the next kind of 30 years, the next 5 years. Really think about what parts of yourself do you want to develop, and really hone into that, and then think about what is it that you need to do as an individual to work on that. And what you will find is when you've done that groundwork, it will open up so much more for you in your profession. Oftentimes, a lot of the work that I do, so in my previous service before I had moved to Geneva, I was working in an IAP service, which is a service that it's a psychological service, which delivers kind of majority of the psychological interventions in the UK. And we worked quite closely with UCL. A lot of our referrals were from UCL students, and a lot of the issues those students faced were this anxiety to have it all figured out. You know, this anxiety to see the bigger picture, to have it all figured out, to know what the next step is. And what that does then create is this sense of imposter syndrome, right? A lot of these students would have been A-star students who've excelled in their personal life, in their academic life, and now have been pushed into the big world, which is a ruthless and really scary at times. And when you don't have a sense of how to navigate that, and when you don't have a sense of yourself as an individual, it can become really anxiety provoking, and it can really eat you up and up. And when you get anxious and when you get worried about the bigger picture, it becomes really difficult to make clear and concise decisions about your future, because the anxiety is what carries you. And you'll often find people make decisions and taking jobs and rushing into a process and finding themselves quite unhappy and quite overwhelmed by what they've stepped into. So I would say allow yourself to take the time that you need. Every one of us are going to need a different amount of time to take that, to reflect on actually the transition that you've now gone through from being a student whose biggest worry were getting those grades to now an adult who has to work who has to provide for yourself, but also fit into the society. You know, you're not gonna, you know, a lot of students oftentimes work in retail settings or customer facing jobs, and with that, what I found, especially from my experience, is that you leave that. Once you finish your shift, that is it, you're done, you don't think about it again. But a lot of our careers, you'll have to develop in it. You have to care about the people that you work with. You have to think about how you as an individual exist. And now there's this new identity and role that is developing, and you don't want to rush into that. You really don't want to. So take the time to really figure out, talk to graduates. I would say that, you know, professions, people that are well established in their field are great, because what they will do is they will give you an overview of the trajectory, right? They will give you an overview of the skills. But recent graduates, people that are juniors in their role, will give you a better sense of the reality of the situation of getting there, because we get so hung up on the actual process that we forget the emotional impact of it. Because I definitely remember, you know, being in various different jobs and being so overwhelmed. And, you know, it's ironic that I'm in mental health settings and I'm the one to break it down, and quite anxious about myself and how I fit into the world, but also quite anxious about the fact that, you know, am I good enough? Am I good enough to get to that point of a general practitioner, to get to that point of consultant psychologist, and all of these things? Because what happens is I've not been around my peers. I've not been around people that are going through the process with me. I've not been around people that are one step ahead of me. So what happens within that is I'm comparing myself to people that have thousands of years of experience and wealth and knowledge and have their whole life built. And when you compare yourself to those, you can get really hung up. You can start to really feel less than. So what I would say is reach out to I think a lot of the universities do alumni processes and systems. So reach out to recent graduates in your field. I have mentored and worked with a lot of students in universities in their third year, and I thought it was more valuable that they work directly with someone like me in a junior role versus, you know, the service manager, because the service manager doesn't know what they're going through. But also you want somebody who's going to connect with you on that human level, who's going to show you that actually, though you're going to become a profession, you still have to maintain an element of your individualism, yourself in that. Because I definitely lost that. I definitely did put on that therapist hat, and often felt like, you know, there was no way of existing between the two. But actually when you merge yourself and who you are and your profession, I think that creates a better mix. And when I was able to find the balance between who Qatra is and who the psychologist is, it definitely made me better at my role, but also it gave me kind of the strength that I needed to make decisions and to be more vocal and to be more present and to invoke changes in my services and advocate for my people. Because I think what we're all going to carry as first generation Somali migrants, but also first generation professionals, is that we're going to have to pave the way for our people, whether it is paving the way for fellow colleagues, so for other people from Somali community to come into the profession. But in healthcare center, you are advocating for anyone who's a BME. You will find yourself being the BAME vocal point, even if you don't want to. And with that, you need to have the ability to think for those communities. You need to have the ability to stand in your conviction, to call your colleagues out, to call your service manager out, to call that consultant out in these things. And if you're not secure in yourself and you haven't had that understanding of your value and what you're bringing to the profession, it's going to be very difficult. It's going to be so difficult to do, because what will happen is you will get swept by the sea of opinions and other people that think differently, who don't have the same perspective as you. One of the best advice that I've got from a fellow clinical psychologist was, she said, I don't want you to be another black face with a white mind. And that really struck me, because as a young profession, I was quite meek. You know, you're the junior staff, you can't, they're saying things and you don't feel like you can speak up. And the reason that conversation came up with is that I had gone on a psychiatric assessment with a colleague, and we went to assess a Somali Hoya, and she was in her bati with her little shash on her head. And after the assessment, I'd read over his note, and he had said that she was unkempt and disheveled. And inside, I was boiling with rage, but did not feel empowered enough to tell him no, because something as simple as making a judgment about someone's appearance will have a huge impact on the level of care that they're getting. So that lady was considered to be more mentally unwell and needing more psychiatric support than she actually did, when in reality she was just at home. She was at home, just having her breakfast, and we had turned up early in the morning, and she had let us into her home as comfortable as she was, and without feeling like she needed to put up that barrier of being presented, well presented, or putting on her outside face, and it had been deemed and assessed as something being wrong. So you need to have kind of that strength to be able to speak up. And I think that's something that takes time and reflection, understanding who you are, understanding your value, understanding and viewing things from your point of view, and knowing that actually your contribution is a lot more valuable than everyone else in that room as the junior member of staff, whether you're Somali or not, because you've got fresh eyes, makes you stand out. So keeping that in mind. So
okay, thanks for that. And then Samira, just really quickly, because I'd really like to open the floor up for question and answers. So yeah, very practically, how can, again, young people looking to land a role in healthcare leverage the crisis to secure a role?
I think Khazra really summed it up really nicely and touched up on a lot of key points, particularly the emotional, psychological aspects. And I think that's definitely things to keep in mind, because that tends to hold a lot of people back from progressing and feeling empowered to take on more responsibilities and roles. But in answer to your question, it's a very difficult statement to make, because at the end of the day, coronavirus is impacting our communities in the world at a global scale really badly. And it's difficult to see the positives in it. However, there is a clear, distinct positive. Definitely the workforce and the work of healthcare workers and healthcare professionals in any capacity at all levels of not just the NHS, but private healthcare work, or anything in any health capacity, we know is going to continue to increase and rise. Judging from this current pandemic and this crisis, I think it's been a wake-up call for many people, especially for those in the government who have now realized that years of austerity and cuts to NHS funding has resulted in low resources, particularly human resources, doctors and people feeling burnt out, and lack of equipment and capacity in hospitals and so on and so forth. So I suspect, and I strongly suspect that even after this pandemic is done and gone, and inshallah it will be done and gone very soon, I hope, that the workforce building and the capacity building in the NHS is only going to rise, not just in the NHS, but also in the private setting. The world of even the private and health tech and digital health market is booming. It was always booming in the US, but it's starting to creep up in the UK, particularly things where you can access your doctors, your therapists, your nurses, your pharmacists from an app or over the phone or even through Skype sessions. All of that is only going to boom over the next 10, 20, 30 years. And we know that. So definitely the two fields of healthcare and IT and tech are definitely going to increase for the foreseeable future, because the need is not only there, we've realized that the demand is only going to increase. But coming back to, people are at various stages of knowing what they want to do or how they want to be able to go down that particular career trajectory that they've decided they're going to do. But for those who don't have an idea, and there's a huge proportion of those, because many of us actually don't have the privilege of knowing what we want to do until much later on, but it's never too late. For those who don't have any idea, I would suggest doing two things. Do this little exercise while you're in quarantine. It may take a day, may take 2 days, but make a list of 10 of your closest friends and family members, people who know you and who know you well, or at least you think know you well, and ask them to answer 2 questions, not in a jokey or informal fashion, but really to seriously think about these, because these answers are going to help you understand yourself better and hopefully be able to be part of your research into what career you may want to do. Ask them 2 questions. What values or what qualities they believe you possess that would be valuable to work in general, and what jobs they see you doing. So ask them, what jobs or what roles do you see me occupying? You knowing me as Samira or as Khadra, what do you think I'll be good at? So what jobs do you see me doing? How do you visualize me working? And also, what qualities, characteristics, or values or personality features in me that you know of that you think would make me successful at that job, or you think would make me good at that job? Because you clearly view me to be a doctor for some reason. Is it because you think I'm caring and compassionate, or you view me to be somebody who'd be really good in IT? Is it because you think I'm very good at problem solving and analytical skills and good with my hands and so on and so forth? So ask them to really write this down or text it to you or email it to you. It has to be a serious research project, okay? So do that, because it will probably give you a better understanding of yourself by viewing yourself through the lens of others. It will actually make you realize that there are a lot more values and features and characteristics to you that you probably never realized you had. And oftentimes, up until this very day, when people say certain things about me, I'm like, are you sure you're talking about me? That's really not how I view myself. Because the way you view yourself and the way others view you is sometimes quite different. So getting that information and knowledge from 10 different people within your circle of friends and family, the closest ones and those who've known you for the longest, is actually a really key thing, and will probably open up your mind to who you are as a person. The second thing I would advise people to do, and this is a personal exercise, is to really write down a short list. It doesn't have to be a long list, maybe maximum 10, minimum 5. Write down a list of ideals and values you have. For example, for you, it's important to have integrity. It's important to have problem solving. It's important to be caring and compassionate. It's important to be a problem solver. It's important to, whatever it is. What are your ideals and values in yourself and what you expect out of your future? So a list of ideals and values, and also make a list of goals. As in, I may want to live in a villa, or I might want to work 9 to 5, or have financial freedom, or have that kind of salary, whatever it is that your goals are. And it doesn't have to be just money and financial career-wise, your goals. Marry them up with your ideals. And oftentimes people will find that they may say something like, my ideals are caring, compassionate, whatever, but I actually want to be a finance director, or I want to be really good at making money, and so on and so forth. And those things don't really marry up. Yeah, it's great that you're caring and compassionate, but your ideals and values don't really match up to your goals. And it will actually make you think deeper within yourself as to what you really want to do, and give you probably, and actually narrow down a list of possible careers and possible jobs that may actually suit your personality, suit your ideals and values, and where you see yourself in 10 years and 20 years time. So that's a separate exercise I get a lot of my mentees to do, who really say to me that I have no idea, because I'm not going to sit here and try and get everybody to do medicine, because we don't need a world full of doctors. We need a variety of professionals. But when it comes to healthcare in particular, we know the healthcare industry is continuing to boom and continuing to increase, and it's going to only increase beyond coronavirus. When it comes to why I chose GP, because again, like Khadra said, mental health is an entire career. It's an entire field. It's not a particular career. Medicine is an entire field. You know, no two doctors are the same. No two practitioners are the same. And the fun fact is, a lot of doctors, people really have this funny view of doctors as just being this really studious, hardworking bookworms who do nothing but work on their surgical skills or medical skills, so on and so forth. I know a lot of doctors, and a lot of my colleagues have businesses on the side. So some people work as part-time GPs and have a wedding photography business on the side. Some people work as part-time GPs and have a complementary therapy business on the side. And some people work part-time as a hospital consultant and spend the other half of the year playing for international rugby, which is what a few of my colleagues in my Cardiff Medical School were doing. They were international rugby players, but medics at the same time. So you can marry up a lot of your interests, and not all your interests are going to be based on money. But of course, you still want to retain that piece of you that drives you, the passion that drives you, which hopefully you will also be able to derive out of your career. But we all know our passion doesn't come from just one avenue. And in my particular case, I am a GP, but I also do a lot of community work. I work with the youth. I mentor and do a lot of mentorship programs. And I also host and organize careers fairs. And I also want to dabble into global health, and I'm an international speaker. Like, there's so many aspects of you that you can develop. So it's very far from the viewpoint as a 17-year-old I had of what a career in medicine is going to entail. So definitely, if you want a career in healthcare, there's always going to be room for more and more people. It's just super important for you to figure out what it is you want to do, because there's tons of different careers in in healthcare, and also understand that if you had a really bad experience with one particular consultant, because there are some really grumpy consultants that want to put you off medicine altogether, it doesn't mean that this is the life you're going to have. You're not always going to be this tired, super angry, and super irritated consultant all the time. He just probably has issues at home. So understanding that your viewpoint on life should never just rely on one person, and it should really rely on a wealth of research and work experience and talking to several different people so that you can get a holistic viewpoint. Choose what you want to do by narrowing down your list bit by bit. So you may start off with 10, and then you'll have 7, then you'll have 5, and continue doing work experiences and speaking to different people and making down a list of pros and cons. And as you grow over the years, your values and your character will actually mature. So you'll realize more and more which from this list is what you see yourself doing. You know, take them off and tick them off as you go along. And do that homework, as Khadra said, do that homework, because the eventual product is going to be you who's super keen, super committed, enthusiastic, and passionate about what you're doing. And any challenges that come your way is not going to be a major problem. You're going to ride that wave, and you're going to enjoy the fruits of success because you've really worked hard for it. I think you're on mute.
Yeah. So thank you both so much for some really, really great points. So just to tie it up, to that final point, use this time to reflect, use this time to reach out to recent graduates, young professionals, learn from their experience, use this time also to develop yourself, and also consider taking up some virtual roles if you can, whether that be research or internships. So I'm going to open the floor up now, so please go ahead and type your questions if you have any. Any questions, anyone? Or you can just unmute yourself and ask.
I think as we're waiting for questions to come through, I think I just want to make one last point, and I think this is a great kind of summary to what Samira was saying. Don't let the fear of no hold you back. You know, don't let the fear of the naysayers, what others may say, hold you back. Ask, and you will get. If you wait for the opportunities to come to you, if you don't put yourself out there, if you don't step out of your comfort zone, you'll find that most things won't happen for you. Put yourself out there. Don't let the fear of you being the only one, the first one, hold you back. So I think that's just something that, you know, has personally helped me, and I think would be a lesson that I wish someone had told me quite early on. You know, put yourself out there. You know, vulnerability and exposing and being transparent with your goals and what you want is more likely to get you somewhere than you holding your cards to your chest and kind of skirting at the back door. So yeah,
I concur.
Thanks for that. Any questions? Final call. Okay, Salma, do you have a question? No. Okay. I just posted a link now for a survey. So I guess if you don't have questions, if you could just take 2 minutes, there's about 5 questions there. I think it'll really help me. So one person asked, can the panel share about their experience pursuing a degree in postgrad, a medicine degree in postgrad?
So the question is, what are the odds of pursuing a medicine degree postgrad?
Yeah, so sort of like as a postgraduate, sorry.
The graduate entry program, you're probably talking about the 4-year program. If you're asking me in comparison to the regular undergraduate 5-year medical program, what are the chances of getting into graduate entry medicine? I cannot tell you for sure because it's not something I've pursued before. I know that graduate entry medicine, at least back in my time, had fewer places than undergraduate medical programs. And I know a lot of my colleagues. So I had 300 medical students with me in my cohort. Excuse me. 300 medical students with me in my cohort. And at least a third of that were mature students. And there was a mix of mature students who had previous degrees and some who've never had a degree before. So mature students over the age of 23, including a good friend of mine was a soldier who returned from the war in Iraq and decided he was sick of killing people and he wants to be a doctor. You know, a 41-year-old mother who was a pharmacist previously, and also had her own business, and she was a mother of an autistic child, also wanted to get back into medicine and pursued, you know, a career in medicine. And there's a whole variety of people. People often think that it's 18-year-olds, white kids, fresh, you know, fresh-eyed, really naive students who end up getting into medicine. Actually, more of medical school contains people who have had degrees in the past, have worked in the past, and who are a lot more mature. But in comparison to an undergraduate entry medical program, I know that there's more spots or more places for entry into medicine via the regular undergraduate route compared to medicine degree postgraduate. And I know you have more exams, for example, the GAMSAT and other exams to do graduate entry medical program, and you need to have at least a minimum of a 2-1 from what I remember to be able even be eligible for it. And it has to be in certain science subjects, and not all subjects and degrees will be accepted. So I guess you can probably apply to a mixture of both. I know you have 4 places per application cycle, so you can apply to a mixture of both. If you really want to go to a particular city or a particular medical school, even if you think it may be really difficult, I'd still apply. At least one of your opportunities should be that, because you just never know if you might get in. Something about your personal statement or your interview might sell it to them. And they are looking for a variety of students. Again, they're trying to fill their widening participation quota. So use that to your advantage. So there's another question, isn't it? Is there a platform available to help with where to start a journey towards medicine? Okay, so if you're talking about the journey into medicine from the time you've decided, I want to apply to medicine, you finished your A-levels or access or whatever it is you're doing, but you want to start applying, I'm part of an organization, actually. I've co-founded it with a colleague of mine called the British Somali Medical Association. And one of the key things we do, amongst other things, is we do access to medicine programs at least twice a year, every year. Of course, coronavirus put paid to that this year, but we do it twice a year, every year. It tends to be in London and Birmingham. And during that one full day, we talk about all the different aspects of medical school entry, including interview techniques and things like that, because it's a lot to go through. I won't be able to summarize that in today's workshop, but there's a lot you can do. And it doesn't matter too much if you've been out of education or you're not the regular student who's, you know, applying to medical school. They do value life experience. How much they value it depends on how they see your life experience. They do value maturity, life experience, you having had done other things and then decided that medicine was for you. Two things you need to satisfy, of course, is that you really want to pursue medicine, that you have a passion for it, and that you can turn out to be a great doctor, which not every 18-year-old can say. Talking about your life experiences, but also there will be certain entry requirements, educational entry requirements that you'll need to satisfy, which may not be the traditional A-levels. It may be that they want you to do an extra foundation year program prior to starting medical school, or they might want you to do access to medicine courses. I know a couple of universities take that, or they might want you to do something else. So my advice to you is, it doesn't matter what station of life you're at, whether you're a mother with kids or you've worked before, or you've been out of education for years, I would directly email the medical schools that you think you may wish to apply to. Tell them about your qualifications, your experience, your journey, your age, the fact that you really want to do medicine, and ask them if it would satisfy the entry requirements. And if not, what can you do, or what would you be eligible for to pursue, so that you'll be able to have that shot at applying to medical school. So they might say, go back and do a year in access, or go back and do a year in foundation program, then apply to medicine, because otherwise there's no point applying if you do not have any of the entry requirements, because they're just going to reject your application without even reading it. So speak to them.
Sorry, go ahead.
Sorry.
And then there was a question for Kadra about what difficulties you had moving countries, and whether you required different qualifications moving from the UK and then to Geneva, and also you switched industries from the NHS to now an international organization. So sort of, what was that process?
So for me, in terms of, so the first part of the question was, what challenges did I face in terms of my qualification? I think working for an international organization has definitely helped me, in the sense that they are a little bit more, you know, flexible in terms of the qualifications that they accept, and they will just like you to have kind of the recognized professional bodies give you the necessary accreditation in order for them to recognize your qualifications. So that wasn't so much of a barrier in terms of accessing it's kind of transition working in a different country. Mental health and psychology is very different in every country. The system is different, how people qualify and the kind of therapies people practice in and the level of support people kind of provide. So the role looks very different in various different countries. So working in an international organization definitely helped that. I don't know how successful I would be applying for a job here in Switzerland, just because I know how different the system is, and it's a private health sector, so they have various different kind of stipulations in place. But in terms of transitioning into working here in Geneva and working in my field, I definitely feel like working in the NHS has prepared me for the best. And I, definitely do feel like as a health practitioner in the training in the UK, what you'll find yourself doing is filling the roles of various different professions in one. You're not just a doctor, you're not just a psychologist, you're so much more than that. And when you step out of that field, you realize actually how skilled you are. I definitely did not appreciate how skilled I was until I came to Geneva and realized actually a lot of what my colleagues are struggling with, I can do that with my eyes shut. A caseload of 150 people, a breeze, managing the caseload, managing the admin that goes with it, but also managing the emotional impact of working on such high pace, high volume environment definitely has set me aside from everyone else and put me in a position where I definitely feel like I shine. And in the COVID response, having that emergency response mechanism has definitely helped me, and it's helped me really kind of hit the ground running and kind of get on with it. So I work with our staff health and wellbeing section here, which means actually we're supporting staff, 7,000 staff globally, deal with the mental health impact of being stuck in places such as Iraq, being stuck in really deep remote locations such as places I've never heard of, so deep places in Mali and Mauritania and various different kind of countries across the world, and really providing them with the support when they don't even have basic health facilities, and they don't even have the basic health living conditions. So working within the NHS has definitely prepared me for that, because you will find that unfortunately, due to the austerity, our NHS is struggling, and our clinicians and our practitioners have so many hats and so many roles, doing so many roles at the same time. So that definitely has kind of given me the strength to be able to transition and to be able to kind of adapt into my role. Because I think one of the key things that they assess in any healthcare profession application process is what are your transferable skills and how adaptable are you. Those are, that when they say to you, you need to have all of these different experiences, and you need to tap into these different parts of yourself. That's what they're looking for. They're looking for your ability to look at your skills and to think about the transferability of those, and how can you adapt into really unideal and hard and difficult situations. As a doctor, I can't even imagine what you deal with. I have worked in general practice in GPs, and have often had to call in my GP colleagues and say, I don't know what's going on here. I need you to step in, and I need you to support this patient with me. And they've gone in because, and contained and maintained that. So they need to know that you can think on your feet and you can firefight. And working in psychiatric settings, you need to also have that same skill. And I would think that's something definitely that is also needed in international organization, in aid-giving organizations, where they are supporting some of the most vulnerable and some of the most needy individuals in our society. So we work with refugees. I mean, you can't get any more, vulnerable than a refugee who is stranded in the shores of Greece or in a kind of remote location. So just really thinking about those, what transferable skills that you have, and selling that. You know, in my interview with UNHCR, I had completely highlighted the difference in the way I work and the difference the way they work, and being able to say, actually, I can adapt and I can transfer my skills in such way, and this is what I bring to the table, and these are the needs that I have identified in your organization. Does that correlate with what you need out of the role? So having that kind of transparency with them in identifying your strengths, but also your weaknesses and your areas of development.
Okay, great. And then we had one last question about how do you manage your personal ambition to practice medicine in the UK with the responsibility to aid those sort of back home in Somalia, particularly in a clinical setting? So Samira, would you like to?
Yeah, that's a really interesting question. And it's not only an interesting question, it's something that really is something a lot of medics and medical students and doctors, particularly of Somali background, do think about. Something that we've discussed in multiple meetings that we had as BSMA, or the British Somali Medical Association. We often do want to be able to hone our skills, develop our practice, become experts in our field, and then be able to do the satisfying work of taking that to a setting, particularly back in our homelands, where you would have the most impact. I think a lot of medics share some of the sentiments in their careers where, although they love what they do on a day-to-day basis, there's a lot of bureaucracy, there's a lot of paperwork, and there's a lot of admin that takes away a lot of their time and energy. Whereas in places like our motherland, you would really be taking necessary resources to the heart of need and where people really require it. The problem is it's such a huge and daunting task, and I'm under no illusion that the healthcare setting in our motherland has broken down at different levels. And I've contemplated multiple times going back and trying to set up maybe some sort of clinic. But then I realized the more I thought about it, it is difficult as an individual or even as two doctors to just be able to go back, set up a clinic and expect to be able to treat people in the best way possible, which is what we aim to do, but also treat them the way you'd expect to treat them in the UK. Because everybody knows that a doctor relies on the experience, expertise, and work of multiple people within the healthcare team. We always work in something called a multidisciplinary team. So for example, as a GP, if I want to diagnose somebody, I'm going to probably need some blood tests. Somebody has to do the blood tests. Somebody has to run the bloods in the labs and produce the results and be able to communicate that back to me. Somebody has to be able to run the scans, the MRIs, the CTs, the ultrasound. And you have to be skilled in doing those scans to be able to produce a report that can be analyzed and has to be fed back to me, for example, before I can do a diagnosis. A doctor on his own doing a spot diagnosis only works for a limited number of conditions. And then on top of that, even if you do prescribe a medication, you're going to require a reliable pharmacist with a good supply of medications that is in date, that is obviously being regulated, because again, you'd want to avoid harm at all costs, making sure that they're aware of the patient's medical conditions, because you don't want side effects to, for example, cause them kidney failure while you're treating the heart, so on and so forth. So it requires multiple levels of our healthcare system to be built up. And I'm aware that me trying to go in and swoop in like Superwoman to try and cover all these needs is just not going to work. And I'm setting myself and the people I go to for disappointment. So this is something that we're going to have to work together as a group. And we do require not just medics, we need all kinds of healthcare professionals, including mental health therapists, radiologists, pharmacists, chemists, so on and so forth, but also require people who are good in management, hospital management, and administrative staff, and people who are good with finance, because at the end of the day, even the NHS is a business. All of these things that I have absolutely no awareness of skills of, because you cannot be a jack of all trades, that is required to run an efficient and equitable health service to even cover the very basic primary healthcare needs of our people back home. And if you're not able to do that, I guess it's almost a disservice to yourself and the people that you're going to just go in there and think that you can set it up. And I know some people go back because they think it's a great business scheme and you're able to make money because it's a private clinic, but I just think that's highly unethical. Mm-hmm. So this conversation needs to be had. I don't have all the answers. It's something that we're trying to work, in cross collaboration with our other healthcare staff, not only to raise funds, but also get the right professionals and expertise to set up something, make sure it's sustainable. Because a lot of things happen for a few months or a year and then close up because it's unsustainable. And we haven't really thought about all the requirements to keep a sustainable and equitable system going on. So I'm it's difficult to say. I'm reluctant to just go in and swoop in and say I've done something for the sake of soothing my conscience. It has to be done with a lot more thinking. And if anybody's able to reach out and think they can help in, because every little helps, we'll hopefully be able to get a cross collaboration and a team going on to do this. Because in this country, we're lucky our government runs the NHS. It's not run by any individual or a company. It's run by the government. And to expect, Somali medics to be able to do the job of a government is extremely difficult.
Mm-hmm. And I would like to just add, as working in an international organization and working with the health systems of multiple different countries, the thing that I've learned is the most important is the strength of the public health sector. The regulations that they have put in place, because they're essentially what holds and maintains the standard of any health sector, and they produce the guidelines that all of us practice under. So I'm sure Samira can attest to this. We don't pull things out of our head. We don't just do things just because we feel like doing it. I don't go into therapy sessions and just wing it. I have guidelines I follow. I have evidence-based therapies that I practice, and Samira also uses evidence-based medicine, and that all comes from the close collaboration and continued work of the public health sectors, which make up that multidisciplinary team. So my understanding of the public health sector in the UK is that you have the consultant psychiatrists, you have all the consultant psychologists, you have the educators, you have the finance, you have the economists, all of those people working together, looking at research to think about how to best support, looking at trends, looking at kind of how our society is developing and things like that. The service that I worked with previously all came out as a result of a famous economist deciding, actually, we're losing a lot of money because a lot of people are off sick for simple and treatable mental health difficulties. So let's look at setting up a mental health setting that isn't secondary or tertiary, that people can just access and can get immediate support on face-to-face digital therapy, so that we are getting people back into the workforce. So it takes up, it's not an individual work. It's not, one doctor does not go back and solve all the problems, but it's about collaborating, and it's about getting a sense of what is out there. Who are your colleagues? Who are your peers? What are they doing? What research is being done? Identifying the need, identifying the shortcomings and the problems, which will then give you a sense of how to piece all of that together to support back home. And I think Somalia definitely has, there are so many issues in the trenches that needs to be ironed out before we as medics and psychologists and therapists can fly in and solve all of our problems. Because practice in medicine will need you to, in order for you to treat someone effectively, you need their basic needs to be in place. And it's something that we definitely struggle with in the NHS actually now, is that you can't treat someone for diabetes if they don't have the access to the appropriate diet. You can't treat someone for depression when they have no home. You can't treat someone for anxiety or psychosis when they just do not have the basic needs. So we need to think about that in a more of a global picture when we're thinking about supporting our country back home. And think about, actually, let's not all flock to one profession. Let's spread our expertise. Let's get our foot into every field that is embodied by the medical umbrella, and in therapy and in education, and then come together and piece that together. So I think what is very important for us is, as a community, as a first generation professions, to be close knit, to think about what are we each doing in our field, and thinking about how can we use that knowledge and that experience to create systems for our people, so that we can then replicate those systems back home.
Okay, and I think, so that was a really, really great discussion. I initially planned for an hour, but we're almost at 2 hours. So I think some definitely great points that were shared. Thank you so much to both Samira and Kadra for taking their time to really give some really, really great advice. I mean, I even learned a few points, and I'm not even in the sector. So thank you both. Final question that we have is, can I get contacts of Samira and Kadra? So if you guys would be open to anyone reaching out to you, then do let me know and I can share those details.
Please do.
Yeah, and I think that's everything. Thank you all for tuning in. Yeah, so look out for more events. Of course, your feedback would be really helpful. And yeah, that's everything. So have a good evening, everyone.
Good luck, everyone.
Thank you.
Try not to get into the stress of having it all figured out. Enjoy the moment right now. Right now, in this present moment, is the only thing that you have for sure, and that you can do something about it. So enjoy it. Don't get bogged down by the bigger picture and chasing a final destination in your career. Like, if you're a first year student, if you're a second year student, if you're a third year student, enjoy that experience. Cry about the exams, and actually recognize that in this pandemic, you are trying to be students, and you're trying to plan your life in a global pandemic. You know, that's not something that me, Samira, or Kule have had to do. So really take that into consideration and be as kind, as compassionate as you can to yourself. And remember, you're doing your best.
Absolutely. And I would concur with everything Khadra said and Kule said. And definitely enjoy the journey. I know it's such a cliche thing to say. One advice I would give to myself looking back is that I stressed so much in my latter teens and early 20s about trying to get my foot into a career, because I felt the pressure and the weight of the burden from society, family, so on and so forth, that I actually don't even remember enjoying myself at all in those years. So just understand that, you know, everybody's going to have a set deadline that you have to be successful by, or get things figured by, or get married by, or this or the other. We put all these restrictions and limitations on ourselves. And as long as you know that you're planning and you're working towards developing your goals, it should allow you to sleep easy at night, because all you can do is try, and you will never live with that regret. And if one door closes, remember, a better door will always open for you, because if it wasn't meant to be, it means it was never good for you. So don't think that I need to spend so much energy lamenting and crying over a closed door, which is very easy to do, and I've done that multiple times. It just may be that, for example, if you don't get into medicine after giving it your best go and trying multiple times, remember and understand that medicine is not the only fulfilling, satisfying, compassionate career, if that is what you're looking for. And ask yourself, why is it that I want to do medicine? Because if your aim in life is to be able to have a job or do something that is able to help people, and why do you want to help people? It's because you want to gain reward in the akhirah, or because you want to feel better about yourself, or you know, your sense of self-worth and value is based on the significance of your interactions with others, making others' lives better, then medicine is certainly not the only way to do that. So always go back to your why and just reevaluate. You may be an amazing financial advisor and a lousy doctor, so you don't have to be a medic all the time. It may not suit you, it may not suit your skills, it may not be your purpose and calling. I would definitely say make lots of dua, pray multiple times on it, but actually work towards researching who you are as a person, and then finding out the job that matches that, not the other way around. And take it easy on yourself and enjoy the process.
Sorry, Kule, I think you're muted.
Can you hear me now? Great. So yeah, like I was saying, stay safe, be healthy, and hopefully I will see you soon in our next event. Goodbye, everyone.
Take care.